Before entering the room, I'm going to check for scene safety. I can see that there are no wires and spillages that may cause any slips or drips. I'm going to close the door or draw the curtains to provide privacy for my patient. And before approaching the patient, I'm going to do hand hygiene according to WHO standards. Applying gel in my hands, rubbing palm to palm, back of the hands, fingers interlaced, fingers interlocked, thumbs in rotational motion, fingertips and allow to dry for 20 to 30 seconds. Now that my hands are dry, I'm happy to approach my patient. Hello, Mira. Good afternoon. My name is Aya. I'm going to be your nurse this afternoon.
Hi, Aya.
Hi. I'm here so that I can remove your urinary catheter. I'm not sure if the doctor has advised you about that. Do you know about it?
Yes.
Perfect. It shouldn't be a painful procedure, but I would like to advise you that there are potential post-catheter symptoms that you might experience, such as urgency, frequency, and discomfort. There's no need to worry about this. These symptoms will go away over time. This is only because it's often caused by irritation of the urethra by the catheter. Is that okay with you?
Yeah, that's fine.
Perfect. So before I proceed to preparing all the materials that I will need for this, Mira, I would like to confirm if I'm indeed with the correct patient. Can you please let me know your name and date of birth as I counter check your wristband and my documentation?
Yes, Mira Abaloni, 1/1/1988.
Perfect. I can confirm that I'm with the correct patient. And since I see no red wristband, I want to ask, are you allergic to anything, Mira?
No.
Perfect. I can confirm that that is the same in my documentation as well. Now that I've confirmed that I'm with the correct patient, I'm happy to proceed and prepare my materials if that's okay with you.
That's fine.
Perfect. So if you need anything, Mira, I'm going to give you this call bell. Please don't hesitate to give us a buzz if you need a hand, okay?
Okay.
Now that I've confirmed that I'm with the correct patient, I'm going to ready and prepare all of the materials that I will need. First, before doing that, I'm going to perform hand hygiene according to WHO standards. Now that my hands are dry, I'm going to put on my disposable apron and put my gloves on. For this procedure, I will need a tray. Miss Examiner, may I confirm if my tray is disposable or reusable?
Disposable.
Right, so I will need a disposable tray. I can see that it's clean, dry, and intact, and I'm happy to use this. I will also need an underpad that is clean and dry and not damaged for later on. I will need an orange bin or a clinical waste bin to discard all of the materials that I will be needing, which is clean, dry, and intact, so I'm happy to use that as well. I will need a pack of sterile gauze swabs that are in a clean and dry and intact packaging. Expires 2026 January, so I'm happy to use that. This will be used for cleaning the patient's genitalia for later. I will need a 10 ml syringe that is in a clean, dry, and intact packaging and expires 2027 October, so I'm happy to use that as well. And I will need normal saline solution or sterile water solution for cleaning the patient's genitalia with for later. It's in a clean, dry, and intact container, no discoloration noted, and expires 2027 June, so I'm happy to use that. So now that I've got all of my materials ready, I'm going to approach my patient. Hello, Mira. I'm back with all of my equipment. I've got everything ready for you, but before I proceed to do that, I'm just going to close the curtains or the door to provide privacy for you. And also, I've checked in your documentation earlier that the volume of the water in the balloon is 10 mils. So I will need to aspirate 10 mils into my syringe in order for me to remove and deflate your catheter successfully. Is that okay?
Yes.
Perfect. So I'm just gonna set this aside on the table here. And then I'm gonna make sure that your urometer is empty or it's not full. If it was full, I would first empty the urometer and put all of the contents in the sluice. But seeing as it's not full, I'm happy for it to be like that. I'm going to set my orange bin first, near where the catheter is. Are you okay, Mira?
Yes.
Perfect. So I'm going to also place this underpad underneath your hips But before doing so, I just want to recheck if I'm all indeed with the correct patient again. Can you tell me your name and date of birth as I check through your wristband?
Yes, Mira Abalone, 1/1/1988.
Perfect. I can confirm that I'm indeed with the correct patient. So I'm going to proceed to put this underpad underneath you. If you lift your hips for me a little. There we go. Is that okay, Mira?
Yes.
Perfect. So now I'm going to open all of the packaging of all my materials here. I'm going to carefully peel cover of my gauze packaging, split it into 2 parts for when I need to clean later on when I remove your catheter. Is that okay?
Yes.
Right. I'm going to open this and I'm going to dampen one part of the gauze pack and I'll leave the other part as dry. Right. Okay. Right, Mira, are we ready?
Yes.
Perfect. So now I'm going to deflate 10 mils from the balloon of your catheter, okay?
Okay.
This shouldn't be painful. Okay, perfect, thank you. So, Miss Examiner, can you please confirm that there's 10 mils in the syringe?
Yes.
Perfect. So I'm happy with that. We've got 10 mils out. That means I can safely remove the urinary catheter. But when I remove it, Mira, I will do it as you are inhaling and exhaling. And I'm going to remove it in a gentle but continuous traction, okay? So don't need to worry. I will give you instructions, right?
All right.
Perfect. So are we ready, Mira?
Mm-hmm.
So I want you to inhale.
Inhale.
Exhale.
Exhale.
Inhale.
Inhale.
Exhale.
Exhale.
Perfect. I've taken the catheter out, Mira. So now I'm going to dispose of this in my orange bin that I have with me. I'm just gonna leave it to the side because I'll need to clean the area before I leave you. Is that okay?
Okay.
Right, but before doing that, I'm just gonna quickly change my gloves because it's gonna be a clean procedure now. I'll do hand hygiene. Right, and I'm gonna put new gloves on. How are you feeling, Mira? Is that okay?
Yeah, that's fine.
Perfect. So I'm gonna make use of this underpad just in case, so that we don't soil the bed. All right?
Okay.
So I'm going to clean your genitalia first with a wet piece of gauze. Sorry, I'm just gonna do that. I'm gonna wipe from front to back in one stroke. In another one. And now I'm going to dry, Mira, okay?
Okay.
Is that okay?
Yeah, that's fine.
Okay, one stroke. Another stroke, perfect. Thank you so much, you're all dry now. I'm going to remove this underpad and replace your bed covers. How does that feel?
That's okay.
Perfect. So Mira, before I go and document and dispose of all of these things, I want to make sure to let you know, I just want to encourage you to do some light exercise and to drink 2.5 liters of fluid every day so that we can get your bladder into its correct pattern of elimination. Also, please let us know if you pass urine, okay?
Okay.
Perfect. So, do you have any other questions for me before I leave and dispose all of my equipment?
No, there's none.
Perfect. So you've got your call bell right there. Please don't hesitate to give us a buzz if you need a hand with anything, okay?
Okay.
Perfect. Thank you, Mira, for your cooperation. So now that I've left the patient's bedside, I'm ready to dispose of all the equipment appropriately. So everything in the orange bin or in the clinical waste bin goes there as well. So I'm gonna put that here. And because our tray is disposable, that's gonna go in there. The packaging will all go in the normal waste bin. And then I'm going to dispose of my PPE, my apron, and my gloves in the clinical waste bin as well. And I'm gonna do hand hygiene to end my station.